Hello, my name is Tucker Pollard, and this is my career presentation for HIIM 237. And over this presentation, I'll be going over the careers of a medical coder and a health information manager and discussing their salary and the future job outlook, such as will AI take over and things like that. So first up I have is medical coding, and medical coders, their job is to convert medical diagnoses and procedures to alphanumeric codes. That way, it can ensure accurate patient billing and data analysis. And by having an alphanumeric coding system, this keeps all the healthcare facility workers on the same page. That way, they don't get confused on certain diagnoses and things like that. And this could be a good choice for someone who wants to work in the medical field, but not hands-on, such as a doctor or nurse. There are many different steps you can take to become a medical coder, but some of the requirements is that you should definitely have a high school diploma or a GED and a bachelor's degree in like health management is also very helpful, but most important are certifications. And the most common certifications for a medical coder would be CPC, CCS, and CPC stands for Certified Professional Coder, and CCS stands for Certified Coding Specialist. You can get your CPC through the American Academy of Professional Coders, and you can get your CCS through HIMA, which stands for American Health Information Management Association. Now, obviously, a salary can vary based on where you live and your experience, and also certifications can play into your salary and your workplace type, such as if you're working in a hospital or a smaller healthcare facility. But overall, in America, the average annual salary for a medical coder is around $60,000, which is around $29 an hour. But for lower entry level positions, the salary can be anywhere from in 45,000 to $50,000 range. And for more experienced coders or someone who would have a lot of certifications, it could be upwards of $80,000. And the job outlook for medical coders is looking pretty good within the next 10 years because within the next 10 years, it's supposed to grow by 9%. And this would create around 17,000 new jobs. And this is a very stable position because there's always a need for healthcare services, regardless of the economic conditions of the world. And with AI coming in, AI can only do so much in this field. And AI is already being implemented into medical coding because it's being used as a tool to help medical coders be able to code faster and more accurate. But still, at the end of the day, it is a human doing your coding. And I don't know if medical coding would be a great fit for me. It is a very analytical position. You have to be very precise. Although that is a lot of healthcare jobs, I think the next career I researched, which is health information manager, would fit me a lot better. A health information manager makes sure records are accurate, complete, and that they are secure. And health information managers work in places like hospitals, clinics, and sometimes insurance companies. A health information manager also oversees the use of health data for patient care, research, and quality improvement. And they also make sure that all information follows privacy laws like HIPAA. And the role connects healthcare technology and management to keep patient data accessible yet private. Same as medical coding, there's many different steps you can take to become a health information manager, but you usually at least need a bachelor's degree in health information management or a similar field. Coursework often includes classes in medical terminology, healthcare data systems, coding, statistics, and healthcare laws. Many employers would prefer for you to have a professional certification like your RHIA, which you can actually get post graduation. And these credentials show solid understanding of healthcare data standards and management practices. Now, the salary outlook for a health information manager would also vary, but is slightly higher than a medical coder, with the annual wage for a health information manager would be around $67,000, according to the Bureau of Labor Statistics. And the future outlook for health information system managers also looks good. And according to the Bureau of Labor Statistics, again, um, is projected to grow 15% from 2024 to 2034, which is very high compared to other occupations. I think a health information system manager would fit me well, and I could see myself working in this position in the future. Plus, I can get my RHIA after I graduate with a degree in health informatics and information management. And throughout the HIIM235 class, which is coding, I have learned a lot about medical coding, and I was comparing it to the research I did on health information management, and I would feel I would do a lot better in this position. Overall, my insight didn't change too much on these careers other than learning what you need to become or learning what you require to become a medical coder or a health information manager. And these are my references.